Start of this week on Monday, we were at 20 cases. We now stand at 29 with 587 people who have been tested for the virus. To talk more about the numbers, we're joined by Communications Director Kevin Tennell. Kevin, of course, thanks so much for joining us as always.
Always a pleasure, Brandon.
You know, we've been following these numbers, and like we talked before the show, the numbers really speak a volume, but they're not always what maybe they are right now. I know you mentioned that.
Sure.
Yeah. Why don't you elaborate on that?
You know, today, of course, on the website, we showed that there's 29, one death, and we've known that for a couple days, but we have gone up considerably since Monday. I think it might be unfortunate that people are paying too much attention to this number, the 29. From the very beginning, since you and I got together, we talked about the low amount of test kits we had here, that we had to reserve the test kits for people that are in the healthcare industry as well as in the high risk category. So for people to really pay attention to that number, I think maybe they're getting a false sense of security, because what maybe they're feeling like is that, well, we only have 29, I can go out and do whatever I want. And that's not the case. We know there's more cases than that. We might have cases that present themselves that are associated with the 29 that we have, but they're asked to self-isolate or isolate at their house so that they can recover. And certainly we still hold on to the test. We got 300 just the other day, but our numbers were already depleted. Mm-hmm. So the point of what I'm trying to say is that you can't really pay attention to the 29 and think, oh, we just have 29. I think people on social media, I think everybody out there hopefully understands that, and that's why we're asking everybody, please stay home. Please wash your hands, wear the masks if you feel compelled, like the CDC says. It's very important at this point because we appear to be starting an uptick, and we know that those numbers are going to start going up and that there are going to be more and more cases around here. So the bottom line, Brendan, is that when you leave the house, anytime you walk outside of the house, everything is a touch point at this point, because we know that there's community spread. We talked about that just a few days ago, and we really need to have people understand that that number 29 gives you a false sense of security if you're thinking that maybe that's just as much as we have. We know there's more.
Yeah, and you know, like you mentioned when we first talked, we talked about that curve, and of course, you know, not having to overwhelm the healthcare system.
Absolutely.
When I see the number 29, you know, I look at the other counties around us, and of course, those are in the hundreds, Maricopa County in the thousands.
Certainly.
So it doesn't seem to me that we have hit our peak yet.
No, not at all. I think you're good. That's a very good point. Patient zero for us was around March 20th or March 21st. A lot of these places that you're looking at, they started theirs much earlier, maybe around March 7th, March 5th. And so their curve after the case of about 3 weeks started really shooting up. We are now getting into that period, and certainly we believe the surge, and let me explain the surge a little bit. The surge is really not that you're going to see so many cases, but the surge of people that will go to the healthcare facility. Maybe they think they have the COVID-19, but we know that there's an allergy season going right now. There's still some flu going around that's not COVID, and then maybe people do have COVID. So we're trying to flatten that curve that we talked about from the very beginning. We expect the surge to begin probably within the next 8 to 10 days, if not sooner. We're already seeing over the past 3 days, 4 on Wednesday, 4 on Thursday, 1 today. We'll see what the weekend has to be. But do not get your axle wrapped around this number right here of 29. We know for a fact that there's more COVID-19 in the area.
And I'm glad you said that. I want to bring up one more thing before we move on, because we do talk about these numbers not to instill fear, but to keep people informed. There is something we're doing right, though, in Yuma County.
Oh, absolutely.
And I know you wanted to touch on that, too.
So the social distancing chart that we have here, and maybe I can move it over, I'll step out of the way and I'll bring it up. This is Arizona, and the social distancing. What we do appear to be doing right is that this website, Unicast, is monitoring how people across the country are socially distancing and applying a grade to that. And while the state of Arizona is at a C right now, Yuma County has been near the top for the past week. In comparison to all counties. If I can get it to move, there we go. So you can see that Yuma County is a B, and we're climbing. And here's the other 14 counties in the state. So that's the thing that we're doing right, folks. So we got to keep doing it right, at least all the way through what we believe will be the surge time. I know that there was a meeting today that many of our city leaders are concerned about getting the economy rolling here. the people that are involved in this recovery process couldn't be any more serious about wanting to get there, but we have to do it safely. And so I don't think we'll see any real discussion about it until after that surge period, so we can evaluate how the model is working here in Yuma County.
Of course, Kevin, we'll continue to follow the numbers for the next 8 to 10 days and see, how things play out. Of course, I appreciate you taking the time to come down to the studios and being transparent with the people here as well. Thanks, Kevin. We'll have you back.